The tropical cyclone Harold, ran away and forgot her. This quote is from a sister of a young person with intellectual disability in Vanuatu, reflecting on the experience of her sister in previous emergencies. While there is much to celebrate in both humanitarian and WASH efforts to leave no one behind, some of the most vulnerable populations are quite literally being left behind in disasters and humanitarian menstrual health efforts. I'm Chloe Morrison, representing World Vision Vanuatu, and presenting on behalf of my co-authors, Relvie Poilapa, also from World Vision Vanuatu, and Jane Wilbur from the London School of Hygiene and Tropical Medicine, on our research and pilot intervention to improve menstrual health in emergencies for people with intellectual disabilities. This project was funded through LRE's Humanitarian Innovation Fund and is in partnership with World Vision Vanuatu, London School of Hygiene and Tropical Medicine, Vanuatu Society for People with Disability, and REMI. Now, if this does seem a little familiar to you, last year we presented on the formative research and the systematized review, and this year we'll be going a bit further and talking about how we turned that research into actual practical tools that can be used to address the needs. So a quick recap, the global situation. Our findings from our systematized review were pretty stark. Firstly, just 51 papers could be included. And this included across all impairment types, not just intellectual disability, but physical impairments, intellectual impairments, visual impairments, hearing impairments, etc. And of the 51 papers, just 26 papers reference menstrual health and disability. And of those, just 9 mentioned disability and menstrual health together, highlighting a great need for further attention, both research and interventions in this area globally. And not surprisingly, what we found was that women and girls with disabilities rarely participated in menstrual health efforts in emergencies. And whilst hygiene kits provided were not always appropriate for people with disabilities. And this was similar for cash transfer programs as well, which often were inaccessible or not appropriate for people with disabilities and their caregivers to be able to access. In the aftermath of Category 5 Tropical Cyclone Harold in Sanma Province in Vanuatu in 2020, and also with households impacted by the Umbai volcano evacuation, we conducted formative research with 17 caregivers and young people aged 15 to 30 with intellectual disabilities to better understand the barriers to menstrual health and hygiene that they face during emergencies. Research tools included participatory tools such as photo voice, and also used participatory observation methods involving a large doll, such as the one you can see on screen there, called Vanuatu, to be able to observe reactions with young people with intellectual disabilities. What we found were that caregivers reported receiving little support to manage the young person's menstruation, both before, during, and after an emergency. Most caregivers reported keeping the young person at home when menstruating, and this is quite pertinent to emergency response when you consider that caregivers at a time during a disaster, if a young person was menstruating, it impacted the household's decision-making in terms of whether they sought safe shelter or evacuated. Young people's support needs sometimes increased after emergencies, and this impacted the household's ability to engage in recovery efforts. And this had financial implications, including being able to afford menstrual products for the young person in the aftermath of a disaster. Poor access to WASH facilities and services also impacted the young people and their caregivers during emergencies. This brings us to the Vanuatu campaign. So along with equipping households with menstrual materials, our formative research showed us the need to develop behaviour change approaches to improve the understanding of menstruation for people with intellectual disabilities and their caregivers. And we anticipated that this would also help improve the effectiveness of traditional interventions that are already going on in a lot of emergency responses, such as hygiene kit distributions. What we heard during our formative research was that there was a lack of understanding about how to use disposable products in some households, particularly in rural areas, whilst reusable pads were not commonly used, and a number of caregivers presented them to us in the aftermath of our interviews and asked us how to use them, or they'd been used inappropriately, such as for dishcloths and things like that. And the campaign was adapted from the Bethesda campaign, which was designed for a development setting in Nepal, which was developed by Jane Wilbur in partnership with London School of Hygiene and Tropical Medicine and WaterAid. And we wanted to see if this approach could be adapted for use in an emergency context to help create improved menstrual health with dignity for young people with intellectual disabilities. So as mentioned, we conducted the pilot in Sanma province in Vanuatu with 38 young people and their caregivers. This was very much in a recovery phase of an emergency response. The project included 2 half-day training sessions that supported the caregivers and the young people to achieve 5 target health behaviours to help manage menstruation more independently and also with greater dignity during disasters. The training aims to be participatory, and by that we mean tools were developed especially for young people with intellectual impairments to enable change and understanding to be captured through observation. For instance, we used the large Vanuatu doll that was on the screen a couple of slides earlier to be able to help the young people to practice changing and disposing of used menstrual materials. We also used a tool, a visual story, which is a short A5 storybook that depicts an emergency coming, the family seeking safe shelter, the young person menstruating in an emergency, being shown love and care and support, such as helping her to rest, being able to access products from the same yellow bag that the young people were given in the campaign, being able to wash the products, dry them, etc. So increasing that knowledge of both menstrual health practices for the young person, but also for the caregiver in terms of menstrual health, menstrual material product use. Outside of the pilot, we also partnered with fellow Elra Humanitarian Innovation Fund awardee Relvie to test the use of reusable period underwear in response to feedback that we had from both caregivers and people with disabilities about some challenges they were having with reusable pads, which typically have a press stud on them. And caregivers with visual impairments were finding them challenging to use, as were people with physical impairments. And so the feedback we have had from caregivers and young people with intellectual disabilities about the period underwear is that they were typically preferred over other menstrual materials. Participants reported that the period underwear were more comfortable and absorbent than other materials, and they could also be washed and dried discreetly because they look like standard underwear. And if you have households that are displaced or different menstrual taboos that mean hanging reusable items, or where disposal of disposable pads may be challenging, this could be a good option, but obviously needing to keep context and cultural needs into account, as well as availability of water. One of the things that was frequently reported in our research was that for any reusable products, typically not enough were provided, particularly in the aftermath of a disaster where it might still be quite wet in terms of flooding or a cyclone that makes it harder to dry products. So an evaluation of the Vanuatu campaign was conducted shortly after the completion of training, and both participants and facilitators thought the intervention was feasible and acceptable for Vanuatu's emergency context. Caregivers reported new and increased knowledge about menstrual health and how to support young people's menstrual health before, during, and after emergencies. Caregivers reported that they would use the menstrual bin and large storage bag to take materials with them when they were evacuating in an emergency. After training sessions, it was reported that young people practiced changing and disposing of the small doll's menstrual materials, providing her pain relief, telling others that the doll was menstruating, showing knowledge and communication about menstrual health that simply wasn't there before the project had started. All of the contents of the period packs, which included reusable pads, were used as well. Caregivers appreciated the reusable menstrual materials, but as mentioned, they did request a greater number be provided. So I think we provided 5 pads per household to ensure that they had enough for the young person, especially in the aftermath of a disaster. Including the direct voice of people with intellectual disabilities can be challenging, but we really wanted to make sure that their voice was reflected in our research and in the feasibility study. And we use Photo Voice, a visual research tool, to be able to do this. This is the first time that this research method has been used with people with intellectual disabilities to explore their menstrual health, and the results were powerful, such as the image of Faylene on the screen there, which shows both a sense of ownership over the contents of the period products, as she says, filling up my bag with calico, meaning filling up her bag with her reusable pads, and understanding the purpose and use of the tools provided. And I met Faylene both before and after the campaign, and the results were so powerful. It was the first time that she herself had been able to manage menstruation independently, and that had both an impact for herself, but also for her caregiver, who is her mother, who is a kindergarten teacher. So that is a lot of information in a short amount of time. Most of the things that I've mentioned, such as our systematized review and also our formative research, have been published, whilst we are in the process of publishing a kind of how-to guide to adapt the campaign for different settings and how we did it in Vanuatu, and also a publication on the feasibility study results. But if you would like any further information, please don't hesitate to get in touch with me. Thank you.